I wanted to review the Frax score for your recent bone mineral density. Osteopenia or bone thinning was noted. Treatment is recommended when the 10-year probability of fracture is greater than 20% for a major osteoporotic fracture and 3% for a hip fracture. In your case, the 10-year probability of major fracture was above these scores. Medications are recommended to improve the mineral density and lower the potential for a future fracture from osteopenia. The established standard for measuring bone density is the dual energy absorptiometry scan, or termed DEXA scan. This scan is performed by passing low energy X-rays through a bone, most often at the lower spine and hips. The DEXA scan results will indicate whether a person has normal bone density, low density mass, or osteoporosis. This particular bone density test is the only one that can be used to diagnose osteoporosis and track bone density changes over time. DEXA imaging results include two scores, a T-score and a Z-score. The T-score compares a person's bone mass with young adults of the same gender. According to the National Osteoporosis Foundation, the scores fall in the following categories. Greater than -1 is normal. -1 to -2.5 is low bone mass, called osteopenia, a potential precursor condition osteoporosis. Less than -2.5 typically indicates osteoporosis. Now, the Frax score has been developed to evaluate fracture risk of patients. It is based on an individual patient models that integrate the risks associated with clinical risk factors as well as bone mineral density at the femoral neck. The models have been developed from studying population-based cohorts from Europe, North America, Asia, and Australia. In their most sophisticated form, the Frax tool is computer-driven. The algorithms give a 10-year probability of fracture. The output is a 10-year probability of hip fracture and a 10-year probability of a major osteoporotic fracture, which includes the spine, forearm, hip, shoulder. Here is an example of a Frax score, or how it's developed. Now, osteopenia is when the bones are weaker than normal, but not so far gone that they break easily, which is the hallmark of osteoporosis. Your bones are usually densest when they're about the age of 30. Osteopenia, if it happens, usually occurs after age 50. The exact age depends on how strong your bones are when you're young. If they are hardy, you may never get osteopenia. If your bones are not naturally dense, you may get it earlier. Recommendations for osteopenia to improve bone mineral density and lessen fracture rates include the following: bisphosphonates and rank ligand inhibitors. Bisphosphates are recommended medications to improve bone mineral density and lessen fractures. They include the following: biphosphonates. Biphosphonates are anti-resorptive treatments and are usually used in the prevention and treatment of postmenopausal osteoporosis. They can help prevent fractures in people at moderate or high fracture risk and prevent bone loss for men and women taking steroids like prednisone. They work by slowing cells that break down bone, or osteoclasts, allowing cells that build bone, osteoblasts, more time to work and reduce the imbalance. Octanil and Fosmex have been approved by the FDA for treatment of osteoporosis in men. There is good long-term safety on the data biphosphonates as well as any medication, but there are also side effects. The most common side effects include muscle aches, joint aches, stomach upset, or heartburn. There are some rare side effects that have been associated with long-term use. These include osteonecrosis in the jaw and atypical femur fracture. This is a list of the biphosphonates available, which include alendronate, ivandronate, resigenate, and zoledronic acid with their brand names. In addition, there is another medication called Prolia, which is a rank ligand inhibitor. The active ingredient is denosumab. It's used to treat osteoporosis in women who have already gone through menopause and have a high risk of breaking their bones. It belongs to a group of drugs known as the rank ligand inhibitor, which prevents certain proteins in the blood from breaking down bone cells. Prolia is available as an injection of 60 milligrams per milliliter dose given under SIN every 6 months. The side effects of Prolia may incur pain in your back, legs, arms, joint pain, weakness and tiredness, acid reflux, symptoms of bladder or kidney function, swelling in the feet, rash, and stomach pain. Serious side effects may include allergic reactions, low blood counts, high cholesterol, bladder infections, and breakdown of bone and jaw. Rare side effects include serious infections, urinary tract infections, and inflammation. Thank you.